of today's life in Africa are such that the extended family system no longer takes care of its elderly. People are moving to urban areas, many are running abroad, many go for cheyo. These make it difficult to look after the elderly in their communities, in the villages. We have to think out of the box to devise a new program which can help the elderly where they are.
HIV/AIDS campaigns in the country have been geared towards the youth mainly. However, the elderly are also facing this challenge with little on emphasis put on promoting their cause.
But we are seeing older people being HIV positive. There is also the reality that older people are sexually active. We need to address them in our prevention efforts for HIV/AIDS. Secondly, AIDS or HIV virus very early goes to the brain, affecting brain function, and will cause dementia and other psychiatric problems. The elderly themselves, because of older brains, are also prone to developing mental health problems, including dementia. In that way, it complicates the care.
Palliative care helps reduce pain in persons with life-threatening illnesses. Drugs like morphine are used in this condition. However, according to the country director of Palliative Care Association, the supply chain is not reaching the end user.
We have challenges within the system, which we are calling the morphine chain supply. There is at times a break within that chain supply, and what we are doing is to make sure we work together with our partners to ensure that this is eliminated. We are trying to do an audit to find out where the challenges are so that our patients don't continue to suffer the.
Though Uganda has tried to train nursing assistants that even other countries do export the labor, in the field of geriatrics, Uganda has only one expert who is also a foreigner. Dr. Waitam is from Singapore. Her, in partnership with Malme Uganda, will see people trained in geriatric fields to help the increasing number of aging people in the country.
Stigma especially now with the rural-urban migration, there's so many complex issues as well as the fragmentation of the family unit that older persons are facing, also the inaccessibility to healthcare, etc. So this course really helps us to equip people who are on the ground, people who are in the communities to care for their older persons. For example, simple things such as giving them the respect and the respect and the support that they need, establishing social support groups within the villages, within communities. These are very practical things that anybody who wants to advocate for geriatric care can do on the ground.
The Senior Citizens Grant has again surfaced with a call to government to increase on the funds given to older persons to make it possible for these to access care, which at times seems to be expensive for them. The challenge of the elderly are immense, and the call for more help, which ranges from financial, psychosocial support among others, is badly needed. Unless government comes in to help the non-governmental agencies in delivering services to older persons, these may live a miserable life till their death. Philemon Chirabo, Top TV News.